Bismillahirrahmanirrahim. Assalamu alaikum dear students. Dr. Rizwan Ahmed here from the Department of Biochemistry, Independent Medical College, Faisalabad. Today we will continue with the next fat soluble vitamin, that is vitamin E. Vitamin E, it is a most potent natural antioxidant which is present in the body. It is not a single substance but rather a family of fat soluble vitamins. It includes the tocopherols. The name tocopherol, it is derived from the fact that the vitamin is concerned with the normal childbirth. It has different forms. One is the alpha tocopherol, beta tocopherol, gamma tocopherol, and delta tocopherol. And they perform different activities in the body. And the other form is the tocotrienol, that is again comprising of alpha, beta, gamma, and the delta tocotrienols, and each vitamin has specific functions in the body. The food sources of vitamin E includes the avocado, eggs, milk, nuts such as the almonds and hazelnuts, seeds, spinach, and other green leafy vegetables, unheated vegetable oils, wheat germ oil, cottonseed oil, sunflower oils, and whole grain foods. Regarding the absorption, transport, and storage of vitamin E is absorbed along with the fat in the small intestine in the presence of the bile salt. They are the necessary for the absorption of the vitamin E. In the liver, it is incorporated into lipoproteins like very low density lipoproteins and low density lipoproteins and transported. Vitamin E is stored in the adipose tissue, liver, and muscles, and the normal plasma level of tocopherol is less than 1 milligram per deciliter. Now we'll talk about the biological and biochemical functions which performed by the vitamin E. It has an antioxidant role. It also have a role in removal of free radicals. It have a protective roles in different diseases. It has been performing function in the reproduction, role in the heme synthesis, and we will discuss one by one. The most of the functions of the vitamin E are related to its antioxidant property. It prevents the non-enzymatic oxidation of various cell components. For example, unsaturated fatty acids by the molecular oxygen and free radicals such as the superoxide and hydrogen peroxides. The element selenium helps in performing these functions. Vitamin E is lipophilic in its character and it is found in association with the lipoproteins, fat deposits, and cellular membrane. It protects the polyunsaturated fatty acids from the peroxidation reaction, and vitamin E acts as scavenger and get itself oxidized. Vitamin E is essential for the membrane structure and integrity of the cells, hence it is regarded as a membrane antioxidant. It prevents the peroxidation of polyunsaturated fatty acids in the various tissues and the membrane, and it protects red blood cells from hemolysis by oxidizing agent. It is closely associated with the reproductive functions and prevents the sterility. Vitamin E preserves and maintains the germinal epithelium of the gonads for the proper reproductive functions. It increases the synthesis of heme by enhancing the activity of enzyme aminolevulinic acid, that is also known as the ALA synthase and ALAT hydrotase. It is required for the cellular respiration through the electron transport chain. Vitamin E prevents the oxidation of vitamin A and the carotenes. It is required for the proper storage of creatine in the skeletal muscles. Vitamin E, it is needed for the optimal absorption of amino acids from the intestine, and it is involved in the proper synthesis of nucleic acid. Vitamin E protects the liver from being damaged by the toxic components such as the carbon tetrachloride. It also works in association with the vitamin A, vitamin C, and the beta carotene to delay the onset of cataract. Vitamin E has been recommended for the prevention of the chronic diseases such as the cancer and the certain cardiac diseases. The clinical trials in this regard are rather disappointing, hence it is no more recommended. However, some clinicians continue to use it, particularly in the subjects of which are susceptible for the cardiac arrest or the heart attacks. It is believed that vitamin E prevents the oxidation of low-density lipoproteins. Vitamin E and the selenium for its biological function. The element selenium is found in the enzyme glutathione peroxidase that destroys the free radical. So selenium is also involved in the antioxidant functions like vitamin E, and the both of them act as synergistically to a certain extent. The dietary allowances and the recommended dietary allowances for the vitamin E. It is required in the infants below the age of 6 months. The requirement is 4 milligrams per day. In infants in between the ages of 7 to 12 months, it is 5 milligrams. The same is the case of male and female in between 1 to 3 years. The requirement increases with the age increases like 6 milligrams, and during the age of 4 to 8 years the requirement is 7 milligrams. The next period of 9 to 13 years the requirement is 11 milligrams per day. The requirement between the ages of 14 to 18 years is 15 milligrams, and in lactating females the requirement is 19 milligrams per day. The deficiency symptoms of vitamin E is related with the fat malabsorption disorders. These are the more likely to become deficient. The digestive tract requires fats to absorb vitamin E. The problems that can arise from the lack of vitamin E are pancreatic diseases, gallbladder diseases, liver disease, and celiac disease. The peripheral neuropathy, the people who lack vitamin E may experience a problem in their nervous systems also. The patient with the vitamin E deficiency may show the signs and the symptoms of hyporeflexia that progress to ataxia, including limitations in upward gaze. The patients with the severe prolonged vitamin E deficiency may also develop the complete blindness, cardiac arrhythmias, and dementia. The patients may present with profound muscle weakness and visual field constriction. So these are the defects due to the deficiency of vitamin E. Now the toxic effects of vitamin E. If it is taken in excess amount like 300 international units, the people may experience the intestinal cramps, diarrhea, fatigue, double vision, and muscle weakness. So we will discuss the patients which are at risk. The persons more than 55 years of age and the babies or the infants with the low birth weight. Those who abuse the alcohol and other drugs, they are at risk, and the patients which are suffering from the cystic fibrosis, celiac disease, hyperthyroidism, malnutrition, and the diseases of the liver, gallbladder, or the pancreatic disease. So these patients are at high risk. So far, we have completed the absorption, storage, functions, and chemical actions of vitamin E, along with that the deficiency symptoms and the excess disorder of vitamin E. I hope you will understand. We will discuss the last fat soluble vitamin, that is vitamin K, in the next lecture. Okay students, Allah Hafiz.